Lung cancer is the #1 cancer killer in both men and women. Preventative screening is the key to survival. We welcome Dr. Nicole Tanner and Dr. Benjamin Toll and Cassie Fraser from the Medical University Health, MUSC's Health, to talk about the importance of lung cancer screening. Why is it so important? I kind of know why, but why is it so important to have lung cancer screening done?
Well, lung cancer is the #1 killer, as you said, of both men and women in the United States, and it's responsible for more deaths than breast, prostate, and colon cancer combined.
Oh, wow. Okay.
And so prior to the advent of lung cancer screening, the mortality was so bad because we weren't detecting these cancers at a time when they were curable. So doing lung cancer screening in the form of a low-dose CT scan allows us to detect cancers at an earlier stage when they're more likely to be cured.
Let's get into the category then. Who should be screened for lung cancer?
Sure. So it's important to screen those that are high risk for developing lung cancer. And we define who high risk is based on age and smoking history. Okay. So the age range goes from 55 to 77 with a current or former smokers, a pack year history of 30 pack years. And if you've quit smoking, you must have quit within the past 15 years.
Okay. 30 pack years, define that for me.
Sure, so it's very simple math. If you smoke a pack of cigarettes a day for 30 years, 1 times 30 is 30 pack years. If you smoke 2 packs of cigarettes a day for 15 years, that's a 30 pack year smoking history. So anything 30 pack years or greater would qualify you for lung cancer screening.
Wow. And the sooner somebody goes in to be screened, if they fall under that category, or even somebody who doesn't, because there is such a thing called non-smokers lung cancer, correct?
Sure. We have to stick to guidelines, though, as far as who we screen. The number needed to screen and people that are non-smokers is cost prohibitive. We'd have to screen thousands and thousands of patients who are never smokers to find those. And so we know that 90% of those that are diagnosed with lung cancers were either current or former smokers.
So the folks that come in and do the screening, the sooner they do that, if they fall under the categories that you were speaking a few moments ago, the sooner they do that, it's more easier to detect those problems that are there, maybe in an earlier stage.
Right, that's the whole point. And if you fall within the categories, we're looking for an earlier.
No,
you're exactly right. We're trying to find those cancers that are early, like stage 1 or stage 2, where we can cure with surgery, as opposed to without screening. Most folks come in and they have stage 3 or stage 4 cancers.
And it shouldn't be all that important if somebody really wants to get it done, but is it covered by insurance?
It's covered by most private plans, by Medicare and Medicaid. And I just want to note, following up on that conversation, that it's really critical that patients quit smoking. So we do provide tobacco treatment services, both counseling plus medicine for patients who want to quit smoking. And so it's critical that they get screened for lung cancer, and it's also important for current smokers to quit smoking.
And when you say quit smoking, that's not quitting smoking and then going to an e-cigarette, correct?
Correct. There's a lot of controversy about the so-called e-cigarettes or nicotine vaporizers. We feel that it's important, if you want to use an e-cigarette, that you try an FDA-approved medicine like the patch first. And perhaps if that doesn't work, patients may come to me. I mean, frankly, some of my patients come in and they're already using one. So at that point, I'm in kind of a bind, because if it's helpful, I don't want to dissuade them. At the same time, if they're using that, I tell them that's fine in the short term, but I want you to wean off of it.
We got just a couple of seconds. Where can people get screening at the Medical University?
So in downtown Charleston, in North Charleston, and in Mount Pleasant.
Okay. Just with the Medical University Health Centers. Very good. Ladies and gentlemen, thank you so much for being here. Some very, very important information. We're coming back in just a moment. With more Low Country Live right here on this Friday morning.